In this video, we are going to talk about popliteal fossa. Popliteal fossa is a diamond-shaped depression lying behind the knee joint. So this is the popliteal fossa. It has diamond-shaped depression lying behind the knee joint. It consists of lower part of femur and upper part of tibia. Now let's talk about the boundaries of popliteal fossa. This diagram shows boundaries of the right popliteal fossa. So this is the lateral side, this is the medial side. In the boundaries, we are going to talk about 4 things. This is the superolateral side, this is inferolateral side, this is superomedial, and this is inferomedial. Superolaterally, boundary is formed by bicep femoris muscle. This is the bicep femoris muscle. Superomedially, boundary is formed by semitendinosus, semimembranosus, and it is supplemented by gracilis muscle. So there is one muscle on superolateral side, which is bicep femoris. 3 muscles on superomedial side, which are semitendinosus, semimembranosus, and gracilis. Now on the inferolateral side, there is lateral head of gastrocnemius and plantaris. And on the inferomedial side, there is medial head of gastrocnemius. So these are the boundaries. Now let's revise. On the superolateral side, there is bicep femoris muscle. On superomedial side, there is semitendinosus and semimembranosus. On the inferolateral side, there is lateral head of gastrocnemius and plantaris. And on the inferomedial side, there is medial head of gastrocnemius. Now let's talk about roof of popliteal fossa. Roof of popliteal fossa is made up of deep fascia, which is also known as popliteal fascia. Now, the superficial fascia over the roof contains, first there is short saphenous vein, as you can see here, this is the short saphenous vein. Second, there are 3 cutaneous nerves. First is terminal part of posterior cutaneous nerve of thigh. As you can see here, posterior cutaneous nerve of thigh and its terminal part. So first is terminal part of posterior cutaneous nerve of thigh. Second cutaneous nerve is posterior division of the medial cutaneous nerve of thigh. Posterior division of medial cutaneous nerve of thigh. And third cutaneous nerve is sural communicating nerve. Let's revise. Roof is made up of deep fascia and popliteal fascia, and there is superficial fascia which contains short saphenous vein. This is short saphenous vein, and 3 cutaneous nerve. So which are these 3 cutaneous nerve? So first is terminal part of posterior cutaneous nerve of thigh. Then there is posterior division of medial cutaneous nerve of thigh, and third is sural communicating nerve. Now we are going to talk about floor of popliteal fossa. Floor of popliteal fossa is also known as anterior wall. So floor will form anterior wall of popliteal fossa and roof will form posterior wall. Floor of popliteal fossa is made up of three things. So which are these three things? First, there is popliteal surface of femur. This is the popliteal surface of femur. Second, capsule of knee joint and oblique popliteal ligament. So this is the capsule of knee joint and this one is the oblique popliteal ligament. So second is capsule of knee joint and oblique popliteal ligament. And the third, popliteal fascia covering the popliteus muscle. Popliteal fascia which covers the popliteus muscle. Now let's talk about contents of popliteal fossa. It is very important to understand. So first is popliteal artery and its branches. Second is popliteal vein and its tributaries. Third is tibial nerve. So there is one artery, there is one vein and there is one nerve. Fourth is common peroneal nerve. Fifth is posterior cutaneous nerve of thigh. Sixth is genicular branch of obturator nerve. Genicular branch of obturator nerve. And seventh is popliteal lymph nodes. And eighth is fat which surround all these structures. After understanding the contents of the popliteal fossa, let's understand how these contents are situated in the popliteal fossa. So, popliteal vessels, tibial nerve crosses the fossa vertically. Popliteal vessels and tibial nerve crosses the fossa vertically, as you can see here in the diagram. First is tibial nerve, and tibial nerve is situated most superficially. After that, there is popliteal vein which lies deep or anterior to tibial nerve, which lies deep or anterior to tibial nerve. And third is popliteal artery which is situated deepest. Now correlate this thing with this diagram. First, there is tibial nerve which is most superficially. So this is the tibial nerve which is most superficially. Then there is popliteal vein. And then deepest of all, there is popliteal artery. So first, there is tibial nerve most superficial. Then there is popliteal vein which is deep to the tibial nerve. and then there is popliteal artery, which is deepest of all. Now you can remember this structure by understanding that in upper part it is AVN. In upper part it is AVN. From medial to lateral. So this is from medial to lateral. Medial to lateral, in upper part there is artery, then there is vein, and then there is nerve. In the middle part, from behind to forward, there it is NVA, which is nerve, then vein, and then artery. So nerve, then vein, and then artery. And in the lower part, from medial to lateral, again it is NVA. So first nerve, then vein, and then artery. So to revise this, there are three main structures in popliteal fossa, which is tibial nerve, popliteal vein, and popliteal artery. Now how they are situated? In upper part, from medial to lateral, as we go from medial to lateral, that is AVN. First artery, then vein, and then nerve. In the middle part, as we go from behind to forward, there is nerve, then there is vein, and then there is artery. And in the lower part, as we go from medial to lateral, there is nerve, vein, and artery. As we go from medial to lateral, there is nerve, then there is vein, and then there is artery. Now, the last topic, clinical anatomy of popliteal fossa. First is that blood pressure from lower limb is recorded from the popliteal artery. Second point is very important. It's about popliteal aneurysm. Popliteal artery is more prone to aneurysm than any other artery in the body. Popliteal artery is more prone to aneurysm than any other artery in the body. Clinically, popliteal aneurysm presents as a pulsatile midline swelling in the popliteal fossa, and it will clinically present as pulsatile midline swelling.